Hi, I'm Kim Bischoff, the Executive Director of the NF Network. Special thank you to all of you for joining us this evening. This is part of our Neurofibromatosis Network research series. It's the second one of three that'll be happening this year. I'd like to give a special thank you and shout out to our sponsor, Alexion Pharmaceuticals, for their support of this series. Tonight's webinar is going to be about breaking down barriers to NF1 care. Our first presenter is going to be Dr. Vanessa Merker. She's a very well-known health services researcher. She's the director of the Family Center for NF at Massachusetts General Hospital and an assistant professor of neurology at Harvard Medical Center. Tonight, she will discuss healthcare disparities affecting adults with NF1 and her research, which is focusing on improving access to quality care. She will also share new educational resources for us for healthcare providers, that impact that they're having on patient care, and the exciting research involving educational videos and peer navigators. Welcome, Dr. Merker. We are really excited to hear what you have to say. We've been long anticipating this reveal that we get tonight. Thank you.
Yes, thank you so much for having me, and thank you to everybody who came today. I was just talking with the NF Network team before the study and kind of research I'll be talking about today couldn't have been done without the support of NF Network and all of its regional affiliates. So many people who have contributed to doing this research, and this is the first official webinar in which we are giving these results back to patients. So you guys are the first in the know, and I'm excited to get your questions and feedback. I'll be here for the whole talk, and I'm happy to take any questions or chat with you as things go on. So I will share some slides I've prepared. All right. And does this look okay, everyone? Yes, perfect. Okay, great. So to get started today, just a quick disclosure, I have received an honorarium from Alexion before for things that have to do with NF1, but nothing to do with what I'm talking about today. And what I talk about today is just my own views as the researcher and don't reflect necessarily the conclusions of my funding agency, which is the Patient-Centered Outcomes Research Institute. So before I got started, I wanted to actually share a little bit about what I work on as a health services researcher. If you haven't heard that term before as a career path, this is what we work on. So this here is the translational research spectrum, and it's what we think about when we think about research and taking it. You might have heard from the bench to the bedside. So here, doing basic science in the lab, discovering new techniques, studying that in mice or other model systems, and then bringing it to humans in clinical trials of new drugs. But what actually I focus on is right here at the end. Once we know how to treat people, what the diagnostic criteria is, what guidelines they need, what treatments work, how do we actually get that into everyday practice so that it benefits the entire population of people with NF? So really the goal of health services research as a field is to provide data, evidence, and new tools that will make healthcare more effective and also accessible and patient-centered. So really this goal of my program here is to ensure that all NF patients, no matter where they live in the country or who they're going to see, can receive the highest quality care possible. And so I wanted to talk to you today a little bit about kind of what are the current gaps in NF1 care that we've seen as we've been looking at the landscape of the United States. And then I'm really excited to share with you about the development of a new educational program, My NF Guide, and how we tested it and are going to be launching it to the public later this year. Just for anyone who I thank you all for so familiar with this, but in case anyone is joining the webinar who doesn't have NF1, has a different type of NF. NF is one is a kind of evolving and multi-system condition. So it can predispose people to a wide range of physical, cognitive, and psychosocial issues that can emerge over the lifespan. And so I know this list can be a little intimidating at first. It feels like there's a lot of things. So not everyone gets each of these issues, but they are things that happen at higher frequency in people with NF1 compared to the general population. And it can happen kind of anytime from birth all the way into adulthood. So really throughout the lifespan, it's important for people with NF1 to be getting regular checkups with their physician just to see if any of these things are happening and keep an eye out so that they can be caught and treat early if they do occur, which is not a guarantee. And so we do actually have clear clinical care guidance from multiple medical societies here in America. So there's the American Academy of Pediatrics, which oversees care for children, and the American College of Medical Genetics and Genomics, which is given advice for adults. And it kind of lays out what care do people with NF1 need. The first thing is they do recommend that people either attend NF clinics or have some sort of care coordination or evaluation at NF clinics if they want to. And then secondly, that they all get regular screenings for various disease complications. And I put an example here, some pictures of what does that mean? What are these screenings? Sometimes it's as simple as something everyone in the population gets, which is blood pressure measurement. So people with NF1 also need to get their blood pressure checked once a year, just to keep an eye out for certain conditions that happen at higher frequency in people with NF1. So something called renal artery stenosis, where the artery to the kidney gets a little narrow, or pheochromocytomas, which is a tumor also in the, ooh, this is where you're going to see I'm not a physician. I think it's also the kidney, but I'll double check that. But it can lead to high blood pressure. Other things are NF1 specific. So, for example, a skin exam just to see whether the different cafe au lait macules or cutaneous neurofibromas have happened that are bothersome that you would maybe like treated. Things like looking out for scoliosis, assessing if kids maybe are having puberty a little bit too early, doing eye exams to look out for optic pathway gliomas, which are the eye tumors. And for adults, one thing is, for example, starting breast cancer screening a little earlier. So at the age of 30 instead of 40 or 50, which is recommended for other folks. And so, even though we have these guidelines that say everybody should get to go to an NF clinic and should get these screenings, unfortunately, it doesn't quite happen yet in the US. So, in some early work that I did when we published this about a decade ago, we looked at the NF Clinic Network as one network of specialized clinics in the US and found that they only served about 13% of the NF1 population, the predicted population that should exist here. And even with recent growth in clinic, I think they actually just announced 4 more in the network today. Still, it's even with that growth in capacity, only about 29% of NF1 patients go to the NF clinic network at any given year. So really, and from just both a capacity and access perspective, it's just not realistic at the moment that everyone is going to the NF clinics for their care. And when we did a recent survey, this was back in 2021 when we asked people in the NF registry where they went to get their care. Even these folks who were really, engaged in the registry, responding to the survey, said that only about half of the kids and a third of the adults had been to a specialized NF clinic in any center, not just the NF clinic network, in the past 3 years. So we know that this is due to a lot of overlapping factors. So I have here an image. This is a recent image of the NF Clinic Network, just so you can get a sense of where the clinics are. And as you can see, they're not evenly distributed across the United States. There's big gaps. And so obviously traveling to NF clinics can be difficult for a lot of people. In the most recent analysis where we mapped where people's locations were in the registry to the clinics, the mean distance was 61 miles, which is, not a small amount to travel and not something that everyone's capable of. We also surveyed patients to ask why they didn't go to clinics. And for adults, a big problem was insurance coverage. So not everyone's insurance covered the exact academic hospitals that NF clinics tend to be located in. And for our parent population, actually, many of them who didn't go said it was because they didn't even know NF clinics existed. Maybe their child had been diagnosed recently. They just weren't aware yet of that resource. And these barriers in access, and these are only 2 of the examples, or 3, I should say, of the examples. There are many reasons otherwise why people might not be able to go to these clinics, but it does lead to disparities in care, specifically for adults. So we did find that adults who have the highest incomes, adults who have a college degree, and adults who live in more urban areas are the most likely to get to go to clinics. And so people with lower income or less education who live in more rural areas do not, which is obviously disparities that we don't want to perpetuate. And one of the reasons that we're really concerned about this is not just in who has access to NF clinics. We found the people who aren't seeing NF clinics are also less likely to get these NF1 screenings. So this lack of access seems to be very much right now attributable to a lack in also getting these screenings on a routine basis, getting the care that people need. So that's to our kind of central research question and what we've been working on for the past few years, which is how can we help NF1 patients get this recommended health surveillance, these screenings that they're supposed to get, knowing most of them don't come to specialized NF clinics like the place I work at Mass General Hospital. And our possible answer to this, what we thought about and brainstormed a few years ago, was what about if we gave educational resources to teach people with NF1 and their local primary care physicians or PCPs information to do some of these screenings with their local already existing care team? And so that's the rationale for how we developed the My NF Guide website. So I have here a screenshot so you can see a little bit about what this is. But we developed a website, and it's a automated program really called My NF Guide, where people can come to our website and they enter a small amount of information. It's less than 20 questions about things like their age, their sex, some of their past medical history, either for themselves or if this is a parent, about their child with NF. And the computer basically uses the answers to those questions as a pre-programmed logic to assemble for each person what are the care guidelines related to NF1 that apply to you. And then it spits out for them a tailored, personalized letter that tells them a little bit about the care that they need. So I have here a sample of some of what that checklist looks like just to show people. This is obviously not personalized, so not every person with NF1 would need every single one of these exams. Some of them it's based on what age you are. Some things like breast cancer screening would only be for women, and et cetera, like that. So we personalize it a little bit, but it's all based on the vetted care guidelines from the American Academy of Pediatrics and the American College of Medical Genetics and Genomics. So it comes from a verified source, and we've just tried to do a little bit of the work about making it sound a little bit more understandable, being a little bit more clear, a little bit more action oriented, and putting it in a nice checklist format. So when people use our website, this is what they would see. And there's some pages after this first checklist page here that have a little bit more information, kind of what is it that we're asking you and your doctor to do, what are we looking for, and what would be the next steps. If, for example, something was found, what would be the next either imaging test or referral or thing that you'd want to do to follow up that finding. And then it ends with this visual here, which is just a summary of all the different things that we keep an eye out for in NF1, just to help people kind of visualize what is it we're checking when we do your annual physical exam. What are we looking for? We also, and I don't have it here, the kind of other core feature of this program is in addition to exporting what you as the patient would read, we also make a version for your primary care doctor. This one is written in more medical kind of language and jargon because it's targeted just at the primary care physician. And we ask you to bring it with you to your next visit. So you can either send it ahead of time. If you, for example, have a electronic medical record portal, you can upload it. Or you could just bring a copy with you and hand it over to the front desk. And that helps tell the PCP both who are we recommending this, that this came from a vetted source here at Mass General Hospital, is based on these guidelines. It's not just a random handout from the internet. And it gives them a quick checklist as well that matches your own checklist of what we are asking them to do. And we hope that that would help primary care physicians take over some of this initial health screening for NF1. And it was a long process to develop it. And I know I showed you a quick snapshot, but I will say a ton went into trying to figure out how this looked and what it contained. We did interviews with NF1 patients, with parents of NF1 kids, with primary care doctors from all over the country to ask what they wanted this to look like. What did they need to know? What were their preferences for how this would be delivered? We then spent at least a year co-designing this with actually an advisory board who I'll show you their pictures soon. We couldn't have done it without their input. And then we did a small pilot study. So that's where we enrolled just a few people who tried it out and actually brought it to their doctor and then gave us feedback about how it went so that we could refine it and make it better. And I want to give a shout out here to our amazing patient parent advisors, our primary care physician advisors, and the NF1 experts who all have been working with our team here at Mass General to develop this. So these are all people who have vetted every version of this, made sure that the information was accurate and clear, wasn't too scary, and was something that PCPs could actually receive and use. And then the kind of exciting part that we haven't shared ever publicly yet before in a patient forum is what happened when we really tested this. So I told you it took a couple of years to get everything together, right, to design this right, because we really wanted to make something that was going to be useful to people. But then the ultimate kind of the proof is in the pudding when you actually test it in a randomized controlled trial, sort of the gold standard of medical evidence. So in this trial, to see if this actually worked, we tested whether these personalized checklists for patients and their PCPs that were delivered via this MyNF Guide website would increase the rates of NF1 screenings in primary care compared to standardized reminder letters. And I do want to share this so folks who signed up for our trial, if there's anyone in the audience who was a participant, A, thank you for signing up. But B, this was something that you, I think, knew that we were testing two different versions, but here I wanted to share more. What were those two versions we tested? So one was the MyNF Guide checklists I showed you, which really summarized what health surveillance is applicable to a specific person. So really try to do that work of digesting the information and presenting it back. And we compared that to something which is better than usual care, because in usual care, your PCP doesn't get any information about NF1, but was standardized. So it was just a letter that asked patients to attend their annual checkup and reminded them that this was important for NF1. And it was a letter for their PCPs that did tell them that these recommendations exist and gave them a link so that they could read it themselves, but it didn't synthesize or kind of digest those checklists. And the reason that we did this is that this, I know it sounds maybe obvious that MyNF Guide, it would be better. Why not give more information? But there are situations, especially in a busy primary care practice, where maybe too much information is overwhelming. There's not enough time. And so we wanted to compare it to a condition that would be kind of more like regular care, where maybe you would get an alert, right? You can kind of imagine a pop-up would come up in the medical record and would tell your doctor, hey, this person has NF1, here are care guidelines for them, and they could click it and read it. Or, we could have an automatic letter that went out to folks right in advance of their appointment saying, hey, it's time for annual checkup. It's really important for NF1 to keep an eye out. So that's why we had this kind of, it's still better than usual, but was more standardized and is something that's like would be a sort of a cheaper, faster to deliver. And we wanted to see, does taking the time to do this special intervention, to make this website, to have this more information, is it really kind of worth, is the juice worth the squeeze, to say another idiom? Does it really make a difference? And so to test that, we did a fully decentralized trial, which means basically fully virtual. Anyone in the US could sign up, and we enrolled 178 adults and 116 parents of kids. Really, it was pretty broad in that they could live anywhere. They just had to have NF and not have gone to a specialty NF clinic in the past 12 months, because we knew that was kind of the group of people who most needed kind of a boost in their care and might need their primary care doctor to take over some of these screenings. And then we enrolled them at any time before their next kind of well visit, annual checkup, annual physical type visit with their primary care doctor. And this is kind of the flow of how this study went. So you would do screening with people, and we consented them all online. They would fill out a survey online, and then they would get randomized. So this means they were randomly assigned to the two groups to either get the personalized letters through MyNF Guide or to just get the standardized letters emailed and mailed to them. They would then go to their regularly scheduled primary care visit with their regular doctor, give them the letters, and then we would follow up with them through a survey and ask, how did it go? What happened at the visit? What did you think of the materials? And That's how we kind of was our primary way of learning what happened. We did also interview a subset of people, so a subset of patients and parents and PCPs to get their feedback. And we also had people, if they were willing, share their medical record, give us permission to request their medical record note so we could just triangulate what did the PCP in their note kind of say that they were doing or had learned about NF1 as an additional data source. And I wanted to share, this is the exciting part we're releasing for the first time is these initial results. So we did finish enrollment for the trial. We just actually had our very last parent participate this weekend. So I have the adult data here, but the parent data is still in process because we literally just hot off the presses finished that earlier this week. But I can show you what things look like for the adults since we finished that arm a little earlier and have had time to kind of dissect it. So just as a reminder, we had 175 people who had actually done the consent. They had filled out the baselines. They were, kind of participating in the study. A wide range of ages. You can see here 21 to 86. There was more women than men, which tends to be the case in a lot of our research studies. So if you're a man on this call, please participate in more research. You can see here some of the other demographics. I did want to highlight, we were really proud of our outreach in that that household income of less than 30,000, that is the lowest quintile of income in America, which means in general in America, about 20% of people make $30,000 or less, and we matched that. So we had good outreach to people no matter what their income was. The same with this rural and urban split. We had known that rural patients were less likely to go to NF clinics, and 21% is actually in general in America about how many people live in a rural area. So we were able to match that, which was really exciting. But there were still some sociodemographic disparities we didn't overcome. You can see we had more white patients in this study than are in the United States of America. So still some work to be doing about how could we do better outreach to other populations. And also, somewhat disappointingly, we also had all of these materials in both English and Spanish, but only were unable to enroll one Spanish-speaking adult. Partly this was due to delays in getting the Spanish version of the website translated and up and running, but also I think just points to some of the work our community can do in trying to better outreach to people who speak Spanish. But I did want to mention it because this resource will be available in both English and Spanish. And so the primary thing that we looked at, which I can share with you today, this primary outcome, is whether or not people had got the health screenings that were recommended by the ACMG. We picked 6 of them. There's more that could be, but these are 6 that most people would be recommended to get. So basic things like, did you get your blood pressure checked? Did they do a neurological exam? Did they check your skin to ask you about any cutaneous neurofibromas? Did they look at your back? So just a kind of look at the back. It's not an imaging or anything, but to look just visually for signs of scoliosis. Did they screen for depression? So did they ask you a questionnaire or kind of ask about your mood? And did they check in about any pain that you were having, which again could be a discussion or it could be that they gave you a standardized questionnaire about pain to fill out and track. And then we counted how many of those 6 things did you get? So I'll say here, it's great. Almost nobody got 0 things, which thankfully I'm glad because they should have gotten most of them. But you can see here in the enhanced usual care arm, so our kind of control arm, kind of a wide spread. Some people got 1 thing, some people got 2, 3, only though about 6% of people got all 6 of these things at their visit. And then the difference that we see here in blue is people who got My NF Guide. So you can see here this dramatic kind of shift to the right where very few people got 0 thing or 1 thing or even 2 things, and then kind of more and more people got the care that we wanted. Of course, not all 6 out of 6. Some of this is because maybe truly a few people didn't need to get some of this care. So for example, if you already have depression, your doctor doesn't need to screen you for depression. They already know that you're being treated, you're seeing a psychiatrist. So you could appropriately skip that. Same thing with something we heard is that some people were seeing specialists. So for example, Maybe you just saw your neurologist last month and they did a neuro exam. So your PCP says, oh, your neurologist took care of that. I don't need to do it for you. So I think just because not everyone got sick, so I wouldn't read that as kind of a disappointing fact. And we're gonna spend a lot of time digging into which of these were kind of appropriately skipped or not. I think the main message, though, we wanted to take and share at this first pass was it does seem like just by giving this checklist to patients and their PCPs, you can definitely shift this curve, and a lot more people will get these screenings in a way that we do think represents true kind of clinical benefit to them. And then this is statistically significant, where the average in got 5 out of 6 in my NF guide and only 4 out of 6 in the control arm, which was really enhanced. So that arm that did at least tell PCPs about what guidelines exist. And I wanted to share just a little bit, the data is one thing and we analyze it in all these statistical ways, but also I think a lot of the proof is in what people just say about having experienced this. And so one mom who participated in our study said, my NF guide gave me something to look forward to at the appointment rather than trying to think of questions on my own. And then it gave my child's pediatrician the opportunity to ask questions that might not have come up. So it was a win-win on both ends. And we had a 53-year-old with NF1 who said that they thought it was really thorough and it takes into account aspects I was already aware of, but also gave him a better understanding of areas that they hadn't considered or had overlooked and opened their eyes to maybe some new issues about NF1 that they needed to pay attention to. And so this was really our goal, to make something that was helpful at all ages for all types of people, no matter how much you know about NF1, because care guidelines are always evolving and changing. It's only been, I don't know, less than a decade that we've even really understood that breast cancer was more likely in people with NF1 and we should start screening early. So I think that's the message I really want to take, is we think this platform is great and we're going to keep it updated. So as we learn new things about NF, we'll add new information, guidelines, so that people, kind of the whole community, can stay up to date on what they should be doing regularly to take care of their health. And I want to wrap up here. I know I've taken a little bit longer than probably my slot was. So I just want to say we have lots of more research to come. We're going to have another dedicated webinar just about this trial to go in even more depth as soon as we finish analyzing what the parents and the children said. So now that we just finished that arm of the trial, we'll get right on analyzing that and can let you know how this worked out for pediatrics. As I had mentioned, we were talking about those interviews we did. So we're analyzing those interviews right now to see what helped and what got in the way of implementing this program. For the people who didn't get that many screenings, what was still a problem? Are there ways we can tackle that even better in the future? We're also testing additions to my NF guide to even better serve adults with NF1, which I'll tell you about. And you can join if you're interested in participating. And then our plan is, as soon as we finish testing these additions and all the research is over, which should be by the end of the calendar year, my NF guide will be released publicly for free. Anyone, anywhere can check it out and use it and see if it's of interest to you. And a shout out here to many of my team members who, if you've been in the trials, you've already been in contact with, but who are leading a lot of this work and analyses. And so the last thing I wanted to chat with, if you don't want to wait till the end of the year and you want to get access to it right now, we are wrapping up our very last study, which is called the MyNF Guide Peer Study, which is really testing, are there even more ways we can help adults better prepare for their annual visits and advocate for the care that they need. So knowing that not everyone's, even with MyNF Guide, got kind of 6 out of 6 recommended items, can we give them even more resources? Would any of this be helpful and of interest? So for this MyNF Guide peer study, it goes kind of the same flow as MyNF Guide in terms of it all being virtual and you're just doing this ahead of your regular PCP visit. The extras, though, are that you either get 10 extra educational videos that we actually acted out and filmed so you could see what all these screening guidelines look like, or you get a 1-hour call with our amazing peer navigator who is actually on the call. I see Stephen Sheard, who can walk you through what these recommendations are and help you plan for how can you get these addressed in the visit, and maybe troubleshoot with you if your PCP doesn't understand one or maybe isn't sure about something, how you can work with them to really advocate and be prepared to ask the questions you want and get the care that you need. And so we are targeting trying to get 50 adults. We have 35 so far. So as soon as we get 15 more people to sign up, then we will be done with this study and we can release everything. So please, if you are an adult and you have a primary care visit coming up, please get in contact with us. There's no requirements. You can go to an NF clinic. We're not. It's open to anyone. And so we'd really love for people to participate. I'll put this in the chat when I'm done speaking, so you can click it if you have a link, but you could also scan this QR code. You do get payment for your time for doing this surveys and participating, and we would love to get your feedback really to make these resources even better and know, is it kind of is it worthwhile? How can we make these even better? And again, the idea would be that these videos also will be uploaded to the MyNF Guide website and available for free as well. So as I close out, I just want to say my take-home message. I know I started by talking about some of the gaps in care that we have in NF and how people, unfortunately, not everybody is currently going to these specialized clinics. And there's a lot of people who aren't getting recommended screenings, but I hope that we ended here on a positive note, which is this work, I hope, shows one way in which we can help people with NF1 partner with their existing care teams to really get these foundational health screenings, staying on top of their NF1. I think there'll be even more research down the pike of ways that we can, find as many ways as possible to plug these holes and help get everyone the care that they need. And so I'm really excited that this is the first venue we've had to kind of share that it works. People could use it. PCPs, for the most part, were able to get the letters, read them, found them acceptable, and at least for adults so far, we've proven it's effective in helping people get more of the care that they need. Of course, we'll start doing more analyses on that to come. And I think I really want to give a shout out again back to all of the partners who've helped us. NF Network, and as I mentioned at the beginning of the call, all of the NF organizations were so critical to getting the word out about this and helping us reach patients beyond NF clinics. And our advisory board members, people who actually are living with NF1, were so critical to co-create this, to make it, I think, something successful. I think there's definitely a version of this that if we had just, as the NF experts, thought of what we thought people should know, could have put out there and maybe wouldn't have been as successful. But because we actually asked patients and PCPs, what do you want to know? What are the gaps that we have? I think that really shows that this really is worthwhile and worth our time and money to kind of invest in those kinds of outreach strategies rather than just relying on, we published an academic paper, here you go, you can read it. And I hope it was enough. And so with that, I just want to quickly thank all of our team members. This was a huge group effort. This is our lab here at Mass General Hospital over the recent years. And of course, our advisory members and funders and everyone who helped out. And so with that, thank you. And I'm so sorry for going a little over time, but I will stay on and I will be here for the whole webinar if people have questions or want to talk more about the study.
Well, Dr. Merker, that was very exciting. We have been waiting for that information for a long time. I am not a bit surprised that it was so successful. Watching you go through this process and how thoroughly you did that study, we're really appreciative of that. And it's such a huge problem to try to reach out to these rural areas and be able to give information to them to help them get better care. And even the individuals, I think of many that this is going to be able to help their lives. We just thank you so very much for your dedication, your leadership, and pushing this very difficult project through. And the great results that we got tonight, we're very, very excited about it. Looking forward to hearing how the My NF Guide peer study goes as part of that.
Yes.
Yeah, and we can't wait to make the announcement that it's open and it's ready to roll for anybody later this year. Thank you. Well, we'll move to our second talk. I'd like to introduce everybody to Dr. Paul Moots. Dr. Moots worked his career at Vanderbilt University. He is a neurologist and a neuro-oncologist and has helped NF families for many years. We're also really proud to have him as a board member at the NF Network. Today, he's going to talk to us about the importance that the NF community plays in research and in clinical trials. Thank you, Dr. Moots. And this research series is actually the brainchild of Dr. Moots. He's the one that came up with this idea. They're very well attended, and we really appreciate his input. Thank you.
Well, thank you, Kim and Mike, and supporting this whole effort, these webinars and research in general. And Vanessa, thank you for sharing. That's really in its design and care and in the stress of the value to people in everyday living with NF. It's really important. In my discussion tonight, I'm going to kind of focus in a little different way on research, and yet there's a lot of parallels in terms of access and barriers and things in getting NF patients involved in clinical research, and that's kind of the direction I'm taking. But it's a wonderful introduction, and you'll see the overlap, and I hope you'll see the slides too, if I can share them.
We see your slides, Dr. Moots.
Okay. Very good. Well, again, my focus and interest today is talking about availability and participation in clinical research for NF and the options that afford that, like the trial, this wonderful trial that Dr. Merker has gone through. The design of that decentralized effort is a remarkable thing in itself, and a relatively new one that she's championed, and really wonderful. So I'm going to talk a little bit about the value, and you've heard already more than I can say on this topic, the value of clinical research for NF, and then kind of go through some of the main forms of clinical research that are available, and looking a little bit into how they're done and who's doing them, and what access is like to them. And hopefully come up with some reasonable conclusions from that. So clinical research is our focus here, and to distinguish it in a way from things that are basic science or non-medical research, and also laboratory research, which in medical terms I tend to think of as preclinical. This talk really focuses on research that involves the participation of human subjects, which sounds a little cold, although it is the language that you often would find in institutional review board evaluations of research projects, or in treatises on ethics of research with human individuals. So human subjects is research is what we're focusing on, and its specialties. In NF, it's clear that over years now, research and publications, which is what you see here listed in publications yearly for NF1, NF2, and schwannomatosis, has increased dramatically, and it has in most medical fields, almost by definition. But it's notable here around just before and just after 1990, the cloning of the NF1 gene and the NF2 gene led to considerable increase in activity, scientific activity, and clinical research as well. And in the late 2000 and early 2010 era, the development and undertaking of MEK inhibitor trials, another huge boost in terms of interest and research, clinical research in NF. So just to see, it's really growing and has been. Is it worthwhile? And how does care get advanced? Well, you've just seen an excellent depiction of that. I picked out three things that I think are fundamental in NF, and two of them: progress in making a diagnosis, in defining diagnostic categories, and diagnostic accuracy has really advanced a lot in the last 2 decades or so. And also in refined care guidelines, and some of these things that Dr. Merker has described as terms of annual monitoring. A lot of this really comes from clinical research and what's important and what are the real risky parts of this condition and such. I also think, and there's been I think a dramatic impact on research in NF because of the effectiveness and the achieving FDA approval of MEK inhibitors for plexiform neurofibromas. These three I think of as really fundamental and remarkable developments that show the value of these efforts. When you look at clinical trials over the years, these are for NF1, and these I've kind of gone through clinicaltrials.gov to call out and categorize, and you can see, particularly oncology, there's been this dramatic increase in the trials started in each of these 5-year blocks. There's a long list of other conditions, and yet somewhat, the gap has widened between the non-oncology and oncology categories or topics. Some of these, like registries, are still ongoing, but there weren't new ones added in this time frame. But anyway, there is clearly a real growth for NF1 clinical research. In NF2, the trends over the years are a little bit more static, and it's much more heavily oncology based or tumor based, and yet there haven't been dramatic increases in the number of trials available. In terms of access, as I started to put this together, I've made my own little chart here, kind of my ideas, and access to clinical research for NF individuals comes in the form of surveys, registries, natural history, and other observational trials, and I'll focus mostly on natural history here, and on interventional trials like drug treatments or Dr. Merker's trial also would be this, or a psychosocial trial. Those kinds of things would fit into this category. And you can see in these that I would guess there's a lot more access. The types of data you collect is a little bit different as compared to in natural history and interventional trials, but both important. The capacity is much higher here than in these other types of trials, I guess. And we'll come back to this or something close to this chart to see if we can say more about that. Other personal views of mine just in practice in our NF clinic at Vanderbilt and in Tennessee, when we had a small survey for patients, a high percentage thought having research available in Tennessee was important to them. They really thought that was valuable. It's always been my impression online surveys and this kind of activity are well received, and yet it's a little hard to find out how many there are and how many people really participate. In terms of the CTF registry and other registries, it's actually kind of easy to estimate from the number of NF individuals in Tennessee, what percent actually participated. 8% is pretty good, and yet I always wonder why it's not considerably more for this kind of research option. In clinical trials, we only had 2 trials available for NF patients, and there are more coming, and in our sphere, there were few, and it made it hard to have access. And we did have patients go to other institutions at times for access to these trials. That's not that unusual, particularly with networks and consortia established for that. When you look in the literature, what do people say about participation? I have one report I like to point to, Dr. Walters, and Dr. Merker's on this too, I believe. They did a survey of adults regarding the design of psychosocial trials. They had 630 respondents, and a high percentage said they'd be interested in being in a trial if it was of interest to them. And yet in that same group, only 6% had ever been in a drug trial and 7% in a psychosocial trial. And it's a little bit the same theme that I saw, where a lot of people think it's a good idea. And yet when you get right down to it, not that many people get involved or able to get involved in interventional research trials. recently I had the chance to ask a really widely known researcher, clinical researcher in NF, about participation in clinical trials and what's a realistic goal. And the comment that came back was every patient should be offered research or a clinical trial opportunity. And yet, I think we all know, and I put a little asterisk, a little set of them here, just to say personal preference and accessibility, and for a number of reasons, it's never going to be 100%. That's not really realistic. So some of what comes after this is to say, well, what is realistic? So if we look at surveys now, we'll start at that point on the list. There's a wide range in looking at surveys, how many people are participating in a single survey or requested to participate. A wide range. There is in these, patient-reported data and outcomes, and it's great that patients can put in what they think is important or respond to questions that focus on their ideas. And yet it's oftentimes things that you can't really measure and have as an objective way as you would like, measuring a tumor on an MRI scan or something like that. To try and get the best data, they use often validated questionnaires and scales and thematic analysis of open comments. And there's actually good statistical ways, sophisticated ways to analyze that data. And yet the types of things you can ask and the strength and validity of the results are different than in a randomized clinical trial, for example. Where do you find these? Well, a lot of times it's through patients who have connected to either registries or participate in local NF organizations, go to NF clinics. Some of it is on social media, and occasionally some surveys are done through research firms. Often you don't find these listed on clinicaltrials.gov, and so it's not so easy to find except by, in a sense, word of mouth or some level of participation. I collected a group of these surveys over the last 5 years from clinicaltrials.gov, and you can see, you can break them down into broad categories of issues, as I've listed here, things that might affect any NF patient, and then others that are much more focused. And this group kind of seems to lead the pack. Again, the total is a little bit hard to define because not only are they not all in clinicaltrials.gov, they're not all published either. Like our little NF Tennessee survey, nobody thought, and we didn't, and would never think of publishing it, but we learned from it. So anyway, some of this is a little bit hard to get at for surveys. If you ask somebody how likely are they to participate in a survey, here's one that was done by the NIH where they surveyed patients who had come to their clinic to get involved in research trials. And of the 68 that they approached, 78% participated. That's really good. And yet, they were there, but not 100% actually participated in the survey afterwards. Kind of interesting. In a lot of surveys, the big ones that are done, the researchers will go through, for example, the CTF registry and other organizations and media, social media. And through CTF, you can tell how many patients were approached, sent an email. And you can see that list here. And here's how many in these studies completed the surveys. And so the percent that actually completed the surveys were considerably lower, in the 5 to 15% range. For a trial, a research effort that really has very little risk, medically almost none, and takes some time, and maybe the biggest risk is putting some personal data in a data bank, in a database. But it seems to me that, I wonder why that isn't higher. In terms of what comes out of these, you can see when you go through an organization or a list to get to patients, it alters a little bit who responds to you. And like Dr. Merker showed, women are more likely than men. It turns out in middle age, more likely. People with higher educational histories, educational status are more likely, and minorities tend to be underrepresented. I think this was kind of like Dr. Merker's comments. There have been a few, or really one that I saw that described using a research firm to request patients to get involved. And they set some guidelines to try and balance these demographic factors. And that's kind of an issue too. But anyway, there are people looking at how to modify that. Here's a good example that does follow closely from Dr. Merker's prior discussion. And I believe she was one of the authors on this. In terms of which type of NF, you can see the breakdown there. 46 is the median age. In this particular one, women outnumbered men quite a bit. And again, minority involvement is relatively low in this one, and that's kind of a common thread or theme. Almost 75% of the individuals responding in this trial had some education after high school, which I think is also different from what you would find in the NF population overall. So is it valuable to the community? Well, certainly it provides direct patient input on important issues. There's a lot of capacity for involvement and participation. A lot of times the studies are only open, the surveys, for a month or 2 or 4 months, and with very low risk in terms of participating. So I think it really does provide a lot. And yet, again, sometimes finding them or knowing they're available is a little bit hard. Let's move on to the registry options for participation. And the big one by far is the Children's Tumor Foundation NF Registry, which began in 2012 and has a goal of 20,000 patients. And so far, they've gotten about almost 12,000, and there's another group that haven't been fully enrolled yet, amounting to 7 to 10% of the NF population in the United States. And I factored in the fact some of the people are not from the United States in this trial. A lot of individuals are really parents who are, participating in behalf of their children with NF. But so this is really a large group, and yet, 7 to 10%, huh? Seems it could be higher. It provides some very important information for stimulating research. It provides messages to patients about trials, clinical trials that match their target issues. And they're in the process of updating the data bank and the website and trying to encourage serial follow-up, updates in the information, more in the form of natural history studies than simply a registry. So it's really on the move. They recently, and Ms. Keltz from CTF provided me with some information about their abstract that they just used this summer to update, the registry data or insights about it. You can see the breakdown among versions of NF. You can see the breakdown in terms of race and ethnicity. In gender, it's a little more balanced, and that's a good thing. It's also the case that if you get to NF Awareness Month in May and tell everybody to sign up, people do it. That there's an impact on the community of getting the word out. That's good to see. and I think they were revamping last year, and this year's data isn't in yet. But anyway, you can connect with this community and they'll respond, which is a wonderful thing to see. There are some other registries, and some of them have really large capacity. So I couldn't find the capacities for the ones at Johns Hopkins, but you can look at them online. But anyway, there are some other things going on. Alexion also had one that's a post-approval study, I believe, for selumetinib. Anyway, moving on again to natural history studies. Now, these are studies people would get involved with to set a starting point and follow and monitor for various developments, stability of symptoms, stability of tumors, or progression and such, where the plan for evaluating is set out in advance and in detail, and does provide objective data for specific features. There are 6 active ones that I could find on clinicaltrials.gov that are enrolling, and 3 others that are sort of completed enrollment but still analyzing data, and 12 others since 2005. So there aren't very many, and yet some of these actually have fairly high levels of capacity for enrolling patients. And here you see this breakdown of the types of natural history studies that have been done over the years, sort of overview of the whole illness, and then specific conditions that come up in the course of the illness that are followed. So natural history studies, not too many, but some large volumes of patients that can be enrolled. And I want to switch gears here and go to interventional clinical trials, drug treatments or non-drug treatments, all kinds of things that would fall under this. There are 2 important research articles that I just want to highlight and shout out. One, Dr. Irby, who did one of these webinars as an NF researcher from Washington University in St. Louis, was the author of this study going through a lot of trials and looking for what was completed and ongoing in 2021. And another from Europe that looked similarly, and you can kind of just see, I just show these to kind of highlight, if you really want to look into availability and participation in trials, these are 2 of the key references to know about. I'm not going to go through all this slide, but here we go. So my little simple review was to go to clinicaltrials.gov and look for currently recruiting or soon to be recruiting trials. And this is for NF1, 16 I found. And the total number of patients, the capacity, if you add all these up, was 850 some patients. This is a relatively small volume compared to the 120,000 NF patients in the United States. So some of the best trials are the ones that are small volume trials. And for NF2 similarly, for NF2 similarly, there are not too many trials, and the number of patients that can be enrolled is relatively small, and yet these are the kinds of trials that produce a lot of impact on clinical care. So here's back to this original chart that I set up for myself to look at these various forms of participation. There aren't huge numbers, and again, in surveys, we don't really know for sure. 6 ongoing registries, 6 ongoing natural history trials, 24 interventional trials, remarkably, and yet that has the smallest number of patients. And if you look along this list in terms of the US population, the capacity in registries far outstrips And I should say, I think surveys plus registries far outstrips those in natural history and interventional trials. Okay. So the points that I think this brings up, and I would like to highlight as conclusions, the options that are available, there are options for almost all NF patients. And I agree with our expert who said everyone should be offered an option or a way to participate in clinical research. And yet it's clear not everyone can. And yet it should be part of their decision making, I think. Surveys and registries represent something, trials or clinical research with low medical risk, wide eligibility criteria, high capacity, and produce a lot of valuable information about care for NF patients. In terms of availability, I think it's very clear more interventional trials are needed. And maybe one of the points I like the best to make is that doing effective research, good, high quality research, and being successful at it, like with the MEK inhibitors, is one of the things that just accelerates and promotes more research, that success begets more research. I think there will be more large interventional trials, and particularly for cutaneous neurofibromas, there are, randomized phase 3 randomized controlled trials. And also in the neurobehavioral topics, there's a lot more randomized controlled trials or large volume trials than in oncology, where most of the trials are phase 2 and relatively small. In terms of participation, learning about research in NF sets the stage in your mind for participating. If you haven't thought about it at all and somebody says, oh, here's a clinical trial for you, it's probably not going to register that this is the best thing to do. Appreciating the value of research. And I think the fact that it impacts care, you've seen a great example of tonight, and it's a great motivating reason for participating in research. The registries and natural history studies, I think, play an important role. They're evolving in how they're used more towards natural history studies. They have a big capacity. They also have an issue of fine-tuning the demographic balance, as it were, to really reflect the NF population. But it seems to me there's the capacity and a realistic goal of having 15 to 25% of NF patients involved, or perhaps 5 to 10% per year as a realistic goal. There's the capacity and there's good reason to be doing more. And so that's my take. That's my look at what's out there and how available is it, how it's being used at this point. So I've probably run over. I don't have a clock, but I'd like to stop. Well, I didn't run over too much. And Kim, I could either take question or we can move ahead, which may be
I think we should
high
move
on
ahead.
your list.
Yeah, we should move ahead right now and save questions for at the end, Dr. Moots, so that we can keep things moving this evening. But thank you very much. That was a delightful presentation. I think we got more work to do as patient advocacy organizations to kind of help assist getting that number of NF people participating in those trials. And I just want to encourage the people who are on the webinar tonight. My daughter has participated in clinical trials, and she feels like it's one of the most rewarding things that she's done. It's also just a really good feeling to know that you're trying to be a part of a solution that's so important to all of us. Thank you, Dr. Moots. Great talk tonight.